Okay, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you a minute about when should I go to the emergency room? Really important question. And if you're watching this video right now, you're probably in a situation where you're trying to figure out what's the right thing to do. Well, first and foremost, if there's ever any question of life or limb, loss of vision, or injury to your eye, or anything like that, it's and your urgent care is not open, absolutely, if it's life threatening, you need to go to the emergency room immediately. Dial 911. You never want to be in the position where you wish you would have dialed 911 and you didn't. Rather be in the position where, gosh, I probably shouldn't have called 911 then. Better safe than sorry every time. I can tell you that I've seen, having worked in the ER over my career, but also having worked in an urgent care center, because I actually am the owner and founder of a national urgent care chain. I've seen patients who have been on both sides of that coin, where they wished they wouldn't have called 911, and then when they wish they would have called sooner. And I always tell the patients who are lamenting having dialed 911, it's better safe than sorry. Don't ever put that off. That's what 911 is there for, to get you to the emergency room quickly and safely, and stabilize you medically en route. If you're having a life-threatening illness or an injury, it's dangerous to try to transport yourself, for example. And if you dial 911, the professionals can get to you and start life-saving measures while you're being transported to the hospital, getting diagnosis and treatment while en route. That's what paramedics and emergency medical technicians are really good at. So if you think you're having a life-threatening illness or injury, for gosh sakes, dial 911 right now. Now, that being said, does everything need to go to the emergency room? No, not at all. If it's not life-threatening, but it could affect your eyes, for example, and it's after hours, and there's not an urgent care center or your primary care doctor or an eye doctor open or available, what normally would be something that you could have gone to an urgent care and gotten treated for, if your urgent cares aren't open in your area, then you're going to have to go to the emergency room just based on the time of day. So if you always want to try to get your care at the most cost-effective and time-effective, appropriate level of treatment, which in most cases is going to be at your primary care doctor or at an urgent care center. But at 2 o'clock in the morning on a holiday, let's face it, there aren't a lot of options in most cities, so you're going to have to go to the emergency room. Now, part of Urgent Care 24/7's model is that we're just that. We're urgent care 24 hours a day, 7 days a week, 365 days a year. So in the cities where Urgent Care 24/7s are located, you always have an option where you don't have to go to the emergency room unless it's absolutely necessary, something life-threatening. But in the case of most communities across America, that 24/7, 365 non-emergency room option isn't available. So I'm just here to encourage you that if you are having what could possibly be a life-threatening situation for you or your friend or family member, dial 911. Better safe than sorry. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe, and when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.